And a government doctor who worked in Ramanagara district of Karnataka has died in Bengaluru, and his brother-in-law, also a government doctor, has alleged that private hospitals turned the patient away in June when he was ill and struggling. Dr. Nagendra, who works with the BBMP, has told his colleagues that his brother, who works in the Health and Family Welfare Department, was turned away from 3 private hospitals as he did not have a COVID test result. Maya Sharma now joins us with all the latest. Maya, there are many such stories, story after story of apathy that plays out in various government hospitals. Any response from the government?
Well, yes, very disturbing indeed that even a government doctor who is related to another government doctor could not get admission in these hospitals. These private hospitals, 3 private hospitals, which they say actually turned them away in June 25th, when they went to take treatment for Dr. Manjunath, who was actually facing respiratory difficulty. They turned him away as he did not have a COVID test certificate. According to his brother-in-law, Dr. Nagendra, who is also a doctor with the BBMP. 3 private hospitals turned him away, and the BBMP officials, the state officials, actually say that they will be reporting these hospitals. Joining us now, Mr. D. Randeep, who is Special Officer. He's working with the BBMP in this battle against COVID-19. Mr. Randeep, thank you so much for joining us. Could you share more details with us with what actually happened to the doctor who passed away so sadly, this government doctor who actually died? What are the details?
Yes, the government doctor was in fact related to medical officer of health of BBMP, and he passed on this news to us. And when we actually ascertained the fact as to why the demise happened, he was initially refused by almost 3 hospitals, and as his COVID test was under process, his was a non-COVID case, but of course the patient was in a state of unrest. He would getting breathless, and there were issues. And when they tried to actually admit the patient in the hospitals kind of refused to admit. And they almost spent about 3 to 4 hours waiting outside the hospital, where they could also see that other patients, other private quota patients were being accommodated while they were being made to sit out. So this the MOH himself has kind of brought to our notice. And we've also taken this on record, and will be reporting to the health department for action.
What kind of action will be taken against these private hospitals, and is it possible to name them at this stage?
I've shared the details with you, and the hospitals are basically now under the purview of the Disaster Management Act itself, and the Commissioner BBMP is authorized to initiate action against them. We have been in this constant battle to also ensure that the private hospital beds have been earmarked for the government and any patients referred by the BBMP. And in several instances, we have also managed to seal the OPD premises of such hospitals, and such action will be taken
Yes, exactly,
up.
because the government is...
Please go ahead, I can hear you.
Yes, the government has in fact been making all efforts to make sure that people are not turned away because they don't have the COVID certificate. And as you said, 2 hospitals were in fact, their OPD was in fact sealed down for 48 hours. How is the government actually trying to make sure that hospitals do comply from now on? Special teams have been formed. What else is being done to make sure that hospitals do comply?
Well, the government has also appointed senior IAS and IPS officers as observers for these private hospitals. Yes. And we've also in BBMP been given certain cluster heads for these hospitals who are coordinating on behalf of the government to ensure that the requisite number of beds are being made available by the private hospitals. So a very close watch is being kept, and we have also developed an online bed management portal where we are able to admit patients on an online portal, and the hospitals are able to view that at their end. It's almost like a pre-booking of a bed prior to the patient reaching there, so that there is no confusion at the end of the hospital or on our authorities as to who is the patient who is going to reach there. And the admissions have to be in a very smooth manner. We also told that non-COVID patients should also be admitted, and certain isolation wards have to be kept for such patients, and they should not be turned away simply because they don't have a COVID positive result with them.
Mr. Randeep, thank you very, very much for joining us with that information. Yes, hospitals are confused because if they're COVID positive, then they should not be with COVID negative patients. And if they're COVID negative, they shouldn't be with COVID positive patients. Thank you, Mr. Randeep, for joining us there. The 3 hospitals against which action will be taken are actually the Rajshekhar Hospital in JP Nagar, the BGS Global Hospital in Kengeri, and the Sagar Hospital in the Dayananda Sagar campus of Kumaraswamy layout. These are the hospitals which Dr. Nagendra has actually said turned away his brother-in-law who later passed away.